I love working at 360 Care because I feel like I really make a difference in people's lives, and the patients that we treat are very appreciative of what we deliver.
I've been providing nursing home care for about 27 years, and when I first started, it was a little difficult. I loved it, but the equipment we had, doing retinoscopy, trial framing patients, getting a good view of the fundus was not very easy a lot of times. When I joined 360 Care, that made all the difference.
Bettering the lives of others is the mission of 360 Care, and it really fits my values because that's why I got into optometry in the first place, is I wanted to have a profession where I could improve the quality of life of people. Three 360 Care really offers great clinical autonomy, and an example of that is that you are allowed to treat the patient the way that you see best. We do have to work within the confines of the facility, so we really want to work with the social worker if we have referrals for surgery or other issues that we think the patient could benefit from outside care. But as far as the clinical decision making goes, 360 Care doesn't tell you how many glasses you need to prescribe every day. There's no quotas. It's really provide the best care for that patient, and we know that that is going to make our services most valuable.
One of the reasons I joined 360 Care was because I had my own nursing home practice for a number of years, and the headaches of running the practice became too much. And when I joined 360 Care, I was able to concentrate on the care of the patient and not worry about all the other aspects of running the practice and employees.
I really feel like by working at 360 Care, I'm giving back to the profession of optometry by elevating our standing within the healthcare community. I get to work with nurses, nurse practitioners, attending physicians in the care of these patients as part of a healthcare delivery team. And they see that optometrists are able to treat glaucoma, treat ocular surface disease, monitor their diabetics, and it really gives us that medical model that optometry needs to continue to raise its standing within the medical profession. Three 360 Care offers a lot of support, both in the back office and in the field. So our back office schedulers really communicate well with the clinicians on what to expect in their visit. And in the field, our technicians do a fantastic job of working our patients up for us, getting a comprehensive history, making sure that we have access to the medical charts when we need it.
They provide the computers, the IT support. If I have any trouble, I can make a phone call and get it taken care of.
It has great hours, so there's no evenings or weekends, which I love. And I love the flexibility of occasionally getting done a little bit early. I love being in different environments and meeting new people, and all those things lend to a great work environment.
When I started in practice early on, I was working a lot of weekends, evenings, and I just did not have much time for family, homework with the kids, the sporting events, the plays. When I joined 360 Care, that all changed. I was able to spend a lot of time, and it really makes a difference.
At 360 Care, we use a lot of advanced equipment. We have TonoPen for our intraocular pressure measurements. We have a handheld slit lamp that's very, very good optics. The autorefractor Auto K from RetinaMax is an excellent instrument, and then probably my favorite is the Volk Pictor. It's this super slick camera that can take a picture of the back of the eye. So it's digital, it's very small and portable. I can take it room to room, I can do it upside down. It's just an amazing piece of equipment.
It really makes a big difference having the right equipment, and it makes it much, much easier to do patient care. And it gives you time to expand your procedures, such as doing punctal plugs and things like that, that in the past when I was doing nursing home care with not as advanced equipment, you didn't have time to take care of the patients like you do today. One bit of advice I would have for anybody who works for 360 Care is engage yourself in the patients. These patients love that you're coming to visit them. And even though it doesn't take much, it takes just a smile, a handshake, just a little small talk about, their children. They think you spent an hour with them when you only spend 5 minutes with them.
The advice I would give you, make sure you talk to people who are doing this job, and really search your heart for, do you love caring for people who need this kind of service? So our providers who are the most successful and the happiest in their job learn to be flexible and just kind of roll with the day. You're never going to have everything work out perfectly, but if you're willing to be flexible and work through them, and really focus on the residents. So if you keep that as your primary, intent in the start of the day, you're going to have a great day, and you'll just overcome the obstacles that you face.
When I hold the hands of a 90-year-old, I'm holding the hands of someone who has rocked many babies to sleep, who've taken care of school children. They all have their own stories. I shake the hands of veterans who have been in World War II and have done great things. And we really need to take care of these patients, and I'm able to do that with 360 Care.